Next, we're going to discuss cognition. Some topics we're going to dive into concerning cognition is generalization, independence, organizing, planning, and attention, as well as adaptive skills. Generalizing knowledge and learned skills and then applying those same skills or knowledge into a different setting is often something that our students are going to struggle with. It's easy to assume that if you teach a student a skill or teach them something that they should know, that they will take that and use it in different environments. However, that is not true, and we often need to teach our student those skills in different settings and multiple different times for our students to understand that one skill can be used in multiple different areas. This doesn't just affect academic skills, it also affects social, behavior, and communication skills. Building independence so our students can be as independent as possible is our ultimate goal and should be considered when making IEP goals and planning interventions. The more skills our students can do independently, the better, and not only to lead a successful life, but the less support that they need to do things such as hygiene, dressing, toileting, financial skills, the fewer opportunities they have of being taken advantage of. We talk about prompts and using prompts with our students, but we also need to talk about prompt dependence. It's extremely important for our learners with autism to know that they don't always need somebody to tell them when and how to do a skill. So it's important when you're teaching a new skill that you have a plan in place to fade those prompts back. Sometimes in the moment, it's hard to see if your student is prompt dependent, so I recommend having someone come in and observe your student and maybe observe how many prompts it takes a student before they actually do the task. This way, you can make a plan for prompt fading. We don't want our students getting in the habit of having someone telling them to do something or them always waiting for someone to do something, because that can set them up for unsafe environments or unsafe situations, but it also just makes them feel like they always have to have someone else, and it does hinder that independence. A lot of times our learners struggle with executive functioning skills. This might look like disorganized backpacks or work areas. They have a hard time keeping track of multi-step projects or activities. If you are a teacher and you set a due date 2 months down the road, that student might not always be able to meet that deadline because they have a hard time planning and organizing. It might look like they have a difficulty maintaining attention to a short task, or they can't shift attention between one or more tasks. We discussed that joint attention deficit, and they might have difficulty sequencing steps. So we must explicitly teach every single one of these skills if those are expectations we are having for our students. Adaptive skills can be difficult for some of our learners on the spectrum. This might look like needing extra support with daily living skills such as using the bathroom or opening a lunch container. They might need some extra support as far as self-directions, looking like setting goals or creating plans. Leisure activities might need to be explicitly taught as well. Home skills such as cooking, cleaning, those types of things. Community use, such as how to navigate a sporting event or concert, or what it looks like going to the grocery store. When we talk about health and safety, knowing community signs and obeying safety laws, understanding medical visits and going to the doctor or dentist, and they might need help with some work skills, how to communicate appropriately, how to look for a job and what applying for a job looks like, following multi-step directions, and things like that.